1 year after the first case of COVID-19 was detected in Australia, the Pfizer vaccine has been approved for use. The Therapeutic Goods Association giving the jab the green light, with Aussies expected to start receiving doses in just weeks. Medical Director at Pfizer Australia, Dr Krishant Tharu, joins us now. Doctor, good morning to you. Nice to see you this morning on This Australia Day. When will the first jab go into an arm here, and can we expect any delays at all?
Yeah, so morning, Karl. So the decision yesterday by the Therapeutic Goods Administration, I think, marks a real turning point for Australia's fight against COVID-19. So the Prime Minister said yesterday that they're planning, as part of their vaccine plan, to roll out a program from late February, and we're very much on track to provide our supplies of our vaccine for that rollout.
Who will get it first?
So the government has outlined a prioritisation program, and that includes aged care residents and workers, frontline healthcare workers and other essential frontline workers such as those working in quarantine hotels and border force who are more at risk.
Are you concerned about your vaccine being administered to the elderly, given what happened in Norway, and also pregnant women?
Yeah. So in terms of the elderly, so they have actually had a look at that in Norway, and the World Health Organization Global Vaccine Safety Advisory Group has actually found that there was no established link with the vaccine. Sadly, in this group of very frail, very elderly people in Norway, around 400 people die each week, and that's been put out by the Norwegian Medicines Agency. Having said that, we always recommend that people, especially if they've got loved ones who are very frail or very elderly, they should speak with their doctor about whether vaccination is right.
The TGA has issued a warning about the frail and those in those particular groups, though, haven't they?
So they've said that people in that group should speak to their healthcare professional and can decide whether vaccination is right.
What about if you're pregnant?
So we don't have a lot of data on that at this stage. So the recommendation from the TGA is that pregnant women should again have a conversation with their doctor. The information that's available so far from animal models and from a very small number of people who have been vaccinated has not shown any untoward effects.
There have been some supply issues. Is there going to be a guaranteed supply of those 10 million doses to Australia?
So we're very much on track to meet our commitments to the Australian government, both for the initial supply from late February and also to supply 10 million doses for Australians over the course of this year. I just want to mention there, I know there has been some talk about supply issues. We committed to ramp up production from 1.3 billion doses in 2021 to 2 billion doses. That required a planned temporary slowdown in production to modify some production lines, add some new production lines, and increase the capacity of the factory. Is
it possible that there will be more than the 10 million? Are you open to that? And I'm sure you are, but is there enough supply for that? And will the government... have you got open talks about that?
So we're in talks. We look forward to having talks with governments around the world, more than 100 countries, and we look forward to having conversations with the Australian government as well to find out what their needs are, whether they need more vaccine, and if that's the case, then we'll certainly do everything we can to help assist their efforts.
So you're definitely open to that?
We're open to the discussions.
OK, if there are variants as a result of the vaccine, the like of which we're seeing South Africa, Brazil, how quickly will we see an updated version of the vaccine, and how long will it take to roll an updated version out?
So the great thing about the technology in the Pfizer vaccine, it uses an mRNA platform, and that can be changed in a matter of weeks to cover potential new strains.
Some of these variants, they're really disturbing, aren't they?
So there is some evidence that they're more transmissible, the UK and South African variant. No clear decision yet or impression of whether they're more deadly, but certainly, obviously, we want vaccines to cover as many of the strains as possible.
Do you know if the Pfizer vaccine covers those variants?
So some initial data from laboratory testing suggests that the Pfizer vaccine will be effective against the UK variant. There is still further research to be done on that, and also the South African and
effectively, if the virus does mutate, the Pfizer vaccine will be able to be updated within weeks and then rolled out.
So the recipe that goes into the vaccine can potentially be updated within a matter of weeks, so much faster than previous vaccines.
It's still a lot to roll out around the world, though, isn't it?
So obviously it takes time to then roll it out against the world.
To be clear, the vaccine doesn't stop transmission, though, yet, does it?
We don't know that yet. So from past history, vaccines that are highly effective in reducing disease usually have an effect on reducing transmission, but that's something that we're still investigating. We hope to have results on that within a number of months.
And do you know the level of immunity you get?
So the clinical data so far from the trial program shows that there's a very high level of immunity. And there's two types of immunity, sort of antibody immunity and what's called T-cell immunity as well. And that has been demonstrated in around 40,000 patients involved in the trial program.
Okay, really good to talk to you. A lot of questions. I'm sorry for a million questions, but appreciate it and hope you can roll them out fast.
Fantastic. Glad to be with you,
Good to talk to you.
Karl.
Thank you.
Thank you.
Ali.